Okay, so today we are gonna show a procedure for shoulder injection. We perform shoulder injection here for a variety of management of shoulder-related pain, which can range from osteoarthritis-related pain. Commonly, though, patient would have a rotator cuff tendon inflammation or rotator cuff tendonitis, or bursitis, which is an inflammation in the joint bursa. So we're going to demonstrate an ultrasound guided injection today, and we're going to start with the procedure now. So first we take a look inside the shoulder for anatomy and if there is any tendon tear that we can demonstrate or fluid collection that need to be drained. So starting here, we locate the humerus. They're just gonna come in, have you come on this side and help with the ultrasound. So here we're looking at the humeral head, which is looking perfectly fine there. Okay. And then here we'll look at long axis shot into the biceps tendon, which looks intact. Good image there. And then here we can actually try to demonstrate the bicipital groove, which is right there. Yeah, and the biceps tendon is projecting as bright white shadow in that area. That's just slightly up. Good, right there. Yeah, excellent. So it looks intact, there is no tears in there. And then over here we start identifying the acromioclavicular joint. That's going to lead us to a landmark, which is a subacromial bursa subsequently. So now the joint is in the middle of the screen there. And then from there we're going to track down to see the subdeltoid space. So here we're looking at the subacromial subdeltoid bursa, where the first injection is going to go. And here we make a little mark on the axis to the joint in that position. Patient arm position now is perfect for that. First axis to the joint, the subdeltoid space. And then also we divide the injection between that spot and also the glenohumeral joint and the back posterior approach to the shoulder. So that is best approach with the patient arm crossed. That will open the glenohumeral bursa. So now we're looking at the head of the humerus again from the back. And down here is the glenohumeral joint. So right there we should take us to access to the joint, which we're gonna mark as well. Very good. So, all right. Okay, so you can return your arm in that position again with your elbow relaxed. Just keep the joint space open. Excellent. Very good. So now we're gonna get sterile and perform the injection. So we're back again after we did prepare the medication, which we're doing a mixture of corticosteroid, Kenalog, and lidocaine for local anesthesia. And everything is done under sterile conditions, sterile drapes. So we're gonna go ahead and give the first injection again after we mark it on the ultrasound. We now know the point, the access point to the subdeltoid bursa with patient arm in this position, slightly touching the hip area with the elbow relaxed. So subdeltoid space is not too deep. It's about maybe 2 centimeter on average, or about like an inch. And if you go with like 45-degree angle like that, you should have an access to it. So there, actually, I already feel the head of the humerus there. So here is gonna go the first injection. And it's going very easy and smooth because it's not a muscular injection, it's into the bursa. If there's a lot of resistance, that means perhaps the needle is not in the right space. With a longer needle, we're gonna access the glenohumeral joint. So I'm gonna ask the patient now to just cross his arm. Sir, can you please do it? Okay, excellent. Good, and that opened the glenohumeral joint. And if you go doing this without an ultrasound, you can use a landmark of the acromioclavicular joint and go in that direction. This is the posterior approach, blind posterior approach to the shoulder. But we have the landmark here that we actually saw on the ultrasound that should lead us into the glenohumeral joint.
Okay.
So it's a little bit deeper, so there. Yeah, again, the injection should be going like almost resistance free. And that's it. Very good. Now the part is done. And here we can demonstrate sometime the presence of the fluid on where we injected. So we're gonna take a look at that now. Same as your arm this way again. First looking into, good. You can come this way a little bit, okay. Good, so there, that space there is where we injected into the subdeltoid bursa. Take an image, good. So here, it's a little bit more prominent. This is where we injected. So this is the deltoid and this is the supraspinatus muscle. And it looks actually fine, it's more expanded. And then here, okay, so we're gonna have you cross your arm again. Very good. And then we're gonna take an image here. Here's that. Good. This is just looking into the glenohumeral bursa, post the injection. And here there is not much expansion in the joint because it's a bigger space, so but there is no complication from the injection itself. Looks good. All right.